up, the Meghalaya government has embarked on a multi-pronged, focused healthcare program for the children across the state. Concerned by the fact that 5,007 newborns in the 0 to 1 year age group of the total 81,000 child population of the state, which translates to 6%, are not vaccinated at all. The Meghalaya Health Department, under the direction of Health Minister Dr. Ampareen Lyngdoh, has launched an aggressive, targeted, intensive initiative to sensitize parents, address many of their beliefs, concerns and myths about immunization and vaccinations, and ensure that every child born in Meghalaya are safe and healthy and grow up to be healthy adults.
First, your thoughts on today's UNICEF CDPS media workshop on immunization.
We are very, very happy to see that the responsible media is actually stepping forward to attend to this important gap that practically every other state in this country have, and that is immunization. Like I said, immunization is the result, but the problem lies somewhere else. You may assign that problem to belief, faith. You may assign that problem to illiteracy or lack of information. You may assign it to any direction or any cause. I'm happy to see that Wasbir and his team and the UNICEF is getting together to guide governance along the right direction.
Ma'am, more than 5,000 infants not immunized in Meghalaya. What is the government doing on those lines?
So we have a very, very aggressive approach to get behind this. And like I said, with the lack of a legal framework, the moment there is nothing legal about making it mandatory for every parent to immunize their child, we have to look at assistance, collaboration, cooperation, and working together with groups, with communities, with civil society. We have targeted a 91% coverage by 2030. Looks like we are getting there.
Health Minister, you already have taken up a lot of steps because there are still a lot of challenges as far as child healthcare, mother's healthcare is concerned. You mentioned about the 1,000-day program that you are coming up with, incentivizing the program, and also drones being used for vaccination. What's your target over the next 3 more years as the Health Minister of Meghalaya?
We are going to ensure that the essential list of medicines as per Government of Meghalaya notification are available up to the last mile, which is the Health and Wellness Center, which is manned by the village themselves. It's called the Village Health Community Organization. And this incentive will be primarily to ensure that mothers who dedicate 1,000 days, the first 1,000 days of a child's life, towards catering to the needs of that child will receive various kinds of incentives.
Meghalaya Health Minister Ampareen Lyndoh speaking to Northeast Live. For Northeast Live, reporting from Shillong, Oinitam Oja with video journalist Debango Das.
And addressing a day-long media workshop on importance of immunization organized by the Center for Development and Peace Studies in collaboration with UNICEF India in Shillong, Health Minister Dr. Lyngdoh said that the government is using drones to transport vaccines to remote areas or areas which are difficult to reach by road. She also spoke about the government's 1,000-day dedication child protection program.
Honorable CM, the Health Minister and the entire Cabinet is committed to governing this people, our people, for the remaining 3-point-something years left. Let's get together on the same page. Let's start talking about the 1,000-day complete and necessary right of every child. My mom, my dad, cannot think of having two more siblings after me when I still need my attention from them. And remember, this is not family planning.
Yeah.
This is family health and spacing, which is good for the family. We're going to promote this 1,000-day project, incentivize it with incentives for every child. 1,000-day project for every child. Every child deserves 1,000-day attention from parents, from family, from everyone. We're going to promote it in a big way. We're going to incentivize it. We're going to look at what else can we do for these kids. We're working with social welfare. Hard to reach villages, we are sending the immunization to these people even through drones.
And earlier, Dr. Valerie J. Lalu, State Nodal Office, Meghalaya Health Systems Resource Centre, gave an overview about the status of immunization and child health in the state.
The reasons are many, and we are trying from our side to solve every problem and issue, and even as of now, UNICEF is along with Gavi. So Gavi is the Global Alliance for Vaccine and Immunization. It is supporting the state in improving vaccination coverage in the state. In fact, Meghalaya, apart from strengthening the routine immunization, we are from, if I can say, from 2017, we had the lowest immunization coverage, around 58%. Now we are at 87%. We have seen, during COVID time, the rest of India was struggling with routine immunization. We were not struggling that much with routine immunization because we kept the momentum going. And what we have done is not only planning. So we have done a lot of trainings for the healthcare workers. We've done a lot of IEC for the people. And we cater to around 81,000 children. That is a cohort every year that we have. And pregnant women, around 88,000 pregnant women every year. So we cater to that number, and we have micro plans at every level, right from the sub-center level. We have plans, micro plans, and we've never had a shortage of vaccine because the vaccines are being given by the Ministry of Health and Family Welfare. So there's no question of shortage of vaccine.
And Northeast Live Editor-in-Chief Wasbir Hussain, who is also the Executive Director of Centre for Development and Peace Studies, underlined the role that the media should play by focusing on important issues like child immunization.
Media serves as a critical bridge between the healthcare sector and the general public, which we all know. And by disseminating accurate and timely information, the media can create awareness about the importance of vaccines and the consequences of immunization. It also can influence public attitudes, shaping behaviors that support better, healthier communities. And because we have seen during COVID that there has been a lot of vaccine hesitancy.
Yeah.
People were still in the rural areas. They are hesitant to take vaccines because they have all the superstitious beliefs and so on and so forth. And sometimes, despite the best efforts of the governments, certain areas are beyond reach of the government workers, health workers. So it is the responsibility of the media to highlight these issues so that the healthcare authorities can see, okay, this is a gap area, we can go there and send our team. So this is the basic objective why we are sensitizing the media, because we as journalists always love to do political stories, but there are a lot of stories beyond politics which affect our communities, affect our children, affect the society as a whole. And media outlets may create engaging campaigns. What can we do? We can create campaigns on immunization, vaccines. Media outlets can also collaborate with health departments to such campaigns, and we can do community-focused campaigns in local languages, may also resonate in rural areas. These are some of the things that we can do. Let us basically join hands to ensure a healthier Meghalaya for our children.